So I've talked a little bit about death anxiety. It's essentially a severe fear of death. And there are cultural variations in the extent to which death anxiety is experienced. Some of that depends on religious and spiritual beliefs. So for example, religions like Buddhism that believe in reincarnation tend to have a lot less death anxiety because they view death as a rebirth rather than like this final end to something. Death anxiety is highest actually for those who have contradictions between their beliefs and their behavior. So for example, someone who maybe believes in like a Christian faith that you're going to go to heaven if you're good and go to hell if you're bad, basically. If they believe that but then they have contradictory behaviors, so they're engaging in sinful activities, then someone in that case is much more likely to have high death anxiety compared to someone who has a consistency between their beliefs and their behaviors. And that's true no matter what the actual belief is. If you're an atheist, and your belief is atheism, as long as your behaviors are consistent with that, you're less likely to have death anxiety compared to someone who has inconsistency. Women are reported to be more anxious about death. This graph shows how death anxiety changes across from early adulthood to late adulthood, and also differences between men and women. Women are in yellow, men are in purple. So death anxiety is higher overall in early adulthood than it is in late adulthood, but men have a more drastic decrease in death anxiety than women do. And there's a number of reasons for that. Part of it might just be reporting. So women might be more likely to openly talk about their emotional fear towards death, whereas men may be more likely to hide that and not talk about it as much. And so when you're doing these kinds of surveys, men may just be sort of obscuring their actual feelings towards death. But in addition to that, because women go through menopause, you have that sort of stark reminder around that age that your body is declining, that you are no longer capable of bearing offspring, and that may be a really sharp reminder for women at that age that death is coming and inevitable. And so it may increase death anxiety for women, whereas men, because their reproductive declines are much more gradual, there's not that like abrupt reminder that they get. So that may also contribute. Death anxiety mostly affects adolescents and early to middle adults. Children are very unlikely to experience death anxiety unless they are suffering from a terminal illness or they live in an area where there's war or high crime to where they're exposed to lots of death. So it mostly affects adolescents and adults. Some of the factors that reduce fear, I already talked about sort of consistency between religious beliefs and practices. Having a more positive view of death, sort of your philosophy of death, also affects this. There's what's called participatory perspective and overcoming perspective. The participatory perspective basically is the belief that death is something that all of us will experience, so it kind of unites humanity. It is natural. It's sort of reaching the fulfillment of the goal of living life as a whole. So it's just a more positive view, whereas the overcoming perspective views death more as like a failure, as basically robbing someone of the opportunities that they had. So someone who has that more positive view, less likely to have death anxiety. Having effective emotional regulation, and also believing in what's called symbolic immortality. That's basically the idea that like I will continue to live on through my children, through my creative works, through the impacts that I've had on other people's lives. If you believe in that, then that can also be can help reduce death anxiety as well. How many of you have ever heard of these 5 stages? Denial, anger, bargaining, depression, acceptance? Okay, what kind of context do you usually hear that in, or what do you like think of when you think of those 5 stages? Yeah.
I think of death as a...
Like which aspect of death, I guess? Yeah.
Like dealing with death of a loved one?
Yeah, so you mostly think of it in terms of grieving someone else who has passed away. Is that pretty accurate? Okay, so these 5 stages really came from what's called Kubler-Ross's theory. Kubler-Ross is just the name of the person who came up with it. There's a lot of misconceptions about this theory and these stages. So one of the misconceptions, she didn't actually suggest this as a theory about grieving. It's actually a theory of the stages you go through when you yourself are facing death. if you've been diagnosed with a terminal illness or you're getting up in old age and you know you're about to die, then these are the stages she suggested you'll go through in facing that. One of the other big misconceptions, she called them stages, but she also clarified she doesn't mean that you go in a particular order, which I think is another misconception. People think you go, it's denial and then anger and then bargaining and then depression and then acceptance, and it's a really pervasive misconception. Even a lot of counselors and therapists believe that you're supposed to go through grief in these stages, and sometimes may even push patients who are grieving or who are facing death to try to go in that sort of stage order. But really what Kubler-Ross said is that these are just different coping strategies. You can go through them in any order. Some people may not go through some of them. Some people may go through all of them. And so again, there's kind of a lot of misconceptions. But the idea again is that if you're facing death, you have these 5 coping strategies that you can use to kind of deal with it. And in addition to those misconceptions, it's also true that dying people respond in many additional ways. So it's not like these 5 capture everything. So for example, if you're diagnosed with cancer or something like that and you're trying to fight it, you maybe want to do chemotherapy and everything that's available. There's not really anything in these that capture that. You could maybe say that's denial, but not really. Like if you have been diagnosed with something and the doctors tell you there's a chance you can survive if you do this, and so that sort of fighting for your life doesn't really fit any of these 5 categories, which Kubler-Ross herself acknowledged. So really the idea of this theory is more that dying people have unfinished needs and that these coping strategies can help to kind of meet those needs. So mostly just wanted to bring this up as a way to sort of clarify some of those common misconceptions. Which, to be fair, before I started teaching developmental courses and really started reading about this theory, I had all those same misconceptions. So they're very common for whatever reason. All right, so I talked a little bit about death with dignity, and this is kind of a similar concept of having what's called an appropriate death. An appropriate death is a death that suits the individual's pattern of living and their own values. So that could be, like religious values, relationships that they have. One of the goals of an appropriate death is to preserve or restore meaningful and significant relationships. So for a lot of people, it's really important if they've had maybe, fights and conflicts within their family, if they have an estranged relative, a sibling or something like that, then they may want to reconcile some of those conflicts before they pass away. Obviously everyone wants their death to be as free from suffering as possible, to have as little physical and emotional pain. A good death, quote unquote, includes achieving a sense of control, feeling like you're making your own decisions about how the process is going, and also confronting and preparing for death kind of head on. Some of the factors that influence coping with death, probably not surprising, the nature and course of an illness. Someone who's diagnosed with something and the doctor tells them you have a chance to survive if you do X, Y, and Z may have a more hopeful view compared to someone who's told, this is really, terminal, you're going to die in 6 months probably no matter what. That sort of nature and course of illness is going to influence how people cope with it. Personality and coping style also play a factor. So people who are more positive and optimistic may deal with death differently from someone who's more pessimistic. People who have a problem-focused coping style will probably deal with it differently than someone who has an emotion-focused coping style. Behavior of family members and health professionals can play a role. Some family members, if they know that a loved one is diagnosed with a terminal illness, they may become very close to that person. They may want to spend as much time with them as they possibly can before they pass away. Others may have a sense of, I kind of want to distance myself because this is emotionally difficult. I don't want to deal with, the thoughts of this. Some family members can be in denial about the fact that a loved one has a terminal illness. The way that health professionals handle the situation also plays a role. And then I also talked a little bit about how spirituality, religion, and culture, depending on your religious beliefs about what happens after death, that can all influence sort of how to cope. Communicating with dying people, very similar to some of the things I talked about with death, talking to children about death, being truthful about diagnosis and course of the disease, listening perceptively, acknowledging feelings, maintaining realistic hope. So if there is some hope that a medication or an intervention can extend life, then maintaining that is helpful. And assisting in the final transition in as many ways as possible, reducing pain, being there as an emotional support, providing sort of advice and guidance. All of those are good ways to communicate.